Hi, everyone. Dr. Nemechek here. I want to talk to you about something that we're having more and more contact with, and it's patients who've had uh, brain surgery for one reason or another, aneurysm clipped, maybe they had a little bleed that had to be removed, uh, biopsy, uh, stimulator implant for Parkinson's or essential tremor, or even now for epilepsy. And what happens is, after some of the patients after these procedures have like brain fog, cognitive problems, balance problems. They'll develop a bunch of neurological problems, and it may not go away. And I want to explain how we can make that what it is and how we can make that go away. So here, just basically for people who've never heard the term craniotomy, basically here's a piece of bone you cut off that's covered duras, this thick tissue over the brain, so you can access part of the brain. That's what a craniotomy is. All right. And what's happening is, now this is an MRI scan. This is cut through the brain. Okay, this is a bony outside. Now, if you cut through the brain and you do something here, okay, patients can have symptoms from everywhere else, even though you didn't disturb that part of the tissue. And this is coming from inflammation, and that spreads throughout the brain. And so I'm going to talk about this study first. So they have people who had a craniotomy, so they had to open their brain, and they took out the spinal fluid and sampled it, and they sampled it time of surgery, and I think up to like 2 weeks later. They did several samples. And a subset of these patients will have what we call a cytokine storm, and the cytokine is interleukin-6. It's one of the common inflammatory chemicals that's released by white blood cells. And this, if it's not released correctly or it's chronic, will have a negative effect. It can damage and harm tissue. Okay, and so what they showed here, now this is about people. And so here, this blue are the people who were impaired after surgery cognitively, had higher levels of this inflammatory chemical than the people who weren't. Okay? Now, they take that spinal fluid and they inject it into the spinal canal of mice. And what they want to do is see what happens. Well, they showed it causes in the hypothalamus damage to cells there. It disrupted the blood-brain barrier that protects your central nervous system from infection. And then here, importantly, it triggered the formation of what we call M1 microglial white blood cells. And so these are inflammatory white blood cells. So not only is this an inflammatory chemical, it actually triggers white blood cells to be even additionally inflammatory. Okay? And that's bad. And that chemical is now throughout the whole brain. It's not just in one area. So the whole brain is being stressed by this stuff. Now, in addition, what they've shown is when you have surgery, okay, and this isn't just neurosurgery, but all sorts of surgeries, what they're finding is there's disruption in the intestinal tract. So you have surgery, and it's either the stress of the scalpel, or maybe anesthesia has some effects or something like that. You have an imbalance of intestinal bacteria, byproducts are leaking into the brain, you have leaky gut, that's what this gap is supposed to represent, stuff's leaking into the body, and it will increase the inflammation in the brain. Okay? Just the surgery can do that. Is that everybody? No. But I think probably a large number of people. Okay? And so now we've got spinal fluid within the brain that's inflammatory. It can trigger white blood cells within the brain that can add to the inflammation in the brain. And now we have this situation where you can also have inflammation coming from the intestinal tract. Now, in a very simplified sense, this is kind of what happens in the gut. So here is, you have stomach, small intestine, large intestine. Our bacteria are laid out with these bird families here. I've got represented by the birds. They tend to live in the small intestine, and the fish bacteria tend to live in the large intestine. So this is a normal layout right here. And what happens is you have overgrowth. You have these fish bacteria now living in the wrong place. Some people call it SIBO. It's often now referred to dysbiosis. This overwhelms the gut, and this is what causes leaky gut and a lot of inflammatory stress coming up to the brain, okay? Now, there's also this chemical called LPS. That's just a molecule on the outside of the fish bacteria. But when that goes to the brain, these white blood cells that are now active up in the brain become permanently active in the brain. And so we refer to this paper showing about these inflammatory molecules released by the white blood cells after injury in the brain. And so a craniotomy is considered an injury exampled by lipopolysaccharide, or LPS. And here they show you, if you have normal brain, no injury, no leaky gut, you get an injury, these white blood cells will turn on, they'll fix things, and then they shut off. And if they would shut off, your cognitive problems would go away. You would repair all of that, all right? But if you've had this LPS either prior or simultaneous to the surgery, these white blood cells now change. We call them primed M1 microglia, and they become permanently inflammatory. Now, a normal microglia is replaced every several months with a brand new one. When they're primed microglia, they become immortal, and they never die, and they are chronically inflammatory. All right? And now, that's why you can have an injury, say you have a craniotomy right over here, and they do a little surgery here, but you have this inflammatory chemical that's flowing through the spine and bathing the entire brain, and you can now have distant areas of the brain not working right, okay? And the symptoms that people tend to see tend to be predominantly, not exclusively, but predominantly injury to what's called the autonomic nervous system, or the ANS. And the autonomic nervous system has a sympathetic, parasympathetic branch. It regulates everything. And basically you end up with two kind of problems. You can end up with a slow intestinal tract, so people might have heartburn or reflux, bloating, cramping, constipation. Some people even maybe sticking, like the motility here won't pass food down correctly. But more importantly, people have trouble regulating blood pressure to their head. They have low blood pressure in the brain, not at the arm, low blood pressure in the brain. We call it cerebral hypoperfusion. You don't get enough oxygen into the brain, and the brain doesn't work right. In a 16-year-old, this is ADD. In somebody who had surgery, we call this just post-surgical cognitive impairment. But if I do brain tests on people, they look like a 16-year-old with ADD. They got the same injuries here, okay? So you can't think, you can't focus, you may stand up at times, and there you're fighting gravity. You might have a little balance issues, okay? It can make you anxious, it can make you grumpy, it can make you hungry, it can make you thirsty, it will impair your sleep, all of that. Okay, and that can all happen from this inflammatory chemicals and these white blood cells throughout the whole brain that get activated. Now, starting 20 years ago, we were working on a strategy to try to get the autonomic nervous system to recover. And we are the first people who've ever presented any data that it's possible. Okay, and I'm going to go through our protocol, and basically this is what the protocol is designed to do, okay? And there's various points here. We got to balance the intestinal tract. Now people look at probiotics and all this herbal stuff. It does not work to get the nervous system to recover. Some of these probiotics and herbal-y things might help your intestinal symptoms if your intestinal bacterial balance is off, but trust me, They don't work well enough to get the brain to recover. What we need is this non-absorbable special antibiotic called rifaximin. Now, if you don't have brain symptoms and you've just had something for a few months, then you only need it for 10 days, twice a day. If it's been for 4 months, well, if you have central nervous system symptoms or whatever your symptoms have been going on more than 6 months, I always start with a minimum of a 4-month, twice-a-day course. So twice a day, every day for 4 months, and it's going to balance those bacteria back. Okay? It'll give you that balance. And when that happens, the inflammation from that goes away. All right? And you'll either get this from a U.S. pharmacy, or if it's not covered because they charge an outrageous price for this, you can get it very, very inexpensively through a Canadian online pharmacy. Now, we have to balance the omega fatty acids, the omega-3 fatty acids, and this is using fish oil. Omega-3 fatty acids are the molecules that your body needs to turn off inflammation, and in particular, DHA is the main one that gets in the brain. So we need a lot of that. And if you have central nervous system symptoms, I recommend a dose of about 300 milligrams per day. If it's non-CNS, I should say non-CNS symptoms, I apologize for that, about half that now for that. So if you just got some inflammatory stuff in your knees, maybe you don't need the full dose for the brain. And now most supplements are fraud, so I recommend using our Nemechek silver capsules, or there's a Now Foods brand called DHA 500. And then the other part of the omega-3s are omega-6s. These are in seed oils. They're highly inflammatory, and that's what olive oil will protect you from. And so you need about 30 ml, which is 2 tablespoons of olive oil a day. It can be spread throughout the day. You can do it at one time. Some people take a shot. I pour it all over my salad every night. But you have to use we have our Nemechek Gold Oleomedico. It's a high phenol olive oil, or some other COC certification. COC certification is the only certification where if you're selling olive oil, you have to send it to a lab at UC Davis, and they will they run about 7 or 8 different tests on it to prove the quality of the oil. Okay, there's somewhere about 75% of the olive oil is fraud or low quality. You need vagus nerve stimulation. This is a way you can get it through TA, means transauricular, so through the skin here. It's a little electrical device. And you can see general times required. If you're 60 years and older, absolutely got to have 2 hours a day. Okay, this helps stimulate control the inflammation in the brain in particular, and those white blood cells that are permanently inflammatory, they calm down with the VNS as well as the DHA. That's why those are specifically in the protocol. And then here in the more recent era, we've added that when people have had COVID, and it could have been a long time ago, it could have been really mild, and now they've shown even if you had COVID and you were asymptomatic, you didn't even know it, it can damage your intestinal tract and give you a different kind of leaky gut that's not related to the gut bacteria. Now, fortunately with this, you only need to take an amino acid called L-glutamine for about 6 weeks. You get 15 grams, so it's got to be the power. Don't buy the capsules. Twice a day for 6 weeks. Use the Now Foods brand. I have several other videos talking about that. So, post-craniotomy, for whatever the cause, you got some bunch of persistent symptoms, brain foggy, stuff like that, and the neurologist's like, well, a lot of people have this, it should go away. If it's not going away, this will make it go away, okay? And so I put some of the references in the discussion segment here on YouTube, and I hope you all find this useful. Other than that, hit subscribe and stay tuned for more videos. Thank you.